You hear the word cancer and everything just kind of stops. Come here.
Rose Ciardiello was just 38 years old when her doctor found a lump in her breast.
She said, "Oh, Rose, how long have you had this lump?" And I was like, "What lump?"
Tests confirmed it was cancer.
My fear was not being here for my kids because they were so young.
Rose's doctors didn't waste time. Soon after her diagnosis, her breast was removed and then reconstructed using a tissue expander and saline implant. But the road to recovery wasn't easy.
I was undergoing chemo, and about a month into the treatment, the incision started to open up. So I had these gaping wounds. We let it heal. I ended up having radiation. So I developed keloid scars.
Then things got worse. A year and a half later, Rose was diagnosed with cancer in her other breast and had a second mastectomy and reconstruction.
I was uneven. There was a lot of scar tissue forming. And I put a stop to all reconstruction. I said, I'm done.
For years, Rose dealt with the discomfort.
Hi, Rose. How are you?
Until she found Dr. Beth Collins, who offers a newer breast reconstruction technique called fat grafting.
When you put fat graft in, it's like almost doing a skin graft. You take some tissue from one place and put it in another place. It'll live on forever. And
using liposuction, Dr. Collins removed fat from Rose's abdomen, processed it into a liquid, and injected it back into her breasts. She also replaced Rose's saline implants with new silicone ones. Before the procedure, Rose's skin was paper thin and discolored from radiation treatments. But afterwards?
Right away, after the surgery, I noticed that my skin had a pink tinge to it, and I hadn't seen that in like 10 years. It was just white and gray color.
This is something that even surprised me in her situation. After the fat graft came in, her skin quality improved so much. It pinked up, it looked more healthy.
Rose says she now has more feeling in her breasts and her new implants are more symmetric.
I don't have to turn away when I walk by a mirror. I don't have to spend 20 minutes getting dressed in the morning to make sure the shirt is, falling the right way.
A mom who can now focus on what matters the most. All right, joining me now is plastic and reconstructive surgeon Dr. Beth Collins. Welcome back to Connecticut Style.
Thank you.
Dr. Collins, what was it like for you to see Rose's transformation?
Oh, it's wonderful. I spend a lot of time with my patients who are reconstructive patients because it's going to take a couple of surgeries to get them to ultimately to where they're going. So over that time, we form relationships, and I consider them like friends. Sure. So I'm watching them get better each time, and during that time they're recovering from their cancer, curing the cancer, and then we could make them whole again, and it's a nice transformation. So
absolutely,
yeah.
Changing their life for them.
Well, hopefully, yeah. Hopefully
Doctor, you mentioned in the story here a little bit about fat grafting, how it might be an option. Explain to us a little further how it works.
There's a lot of tools that we use for breast reconstruction. So whatever the method is that you choose to do, fat grafting is the useful adjunct in a lot of those. It's not the answer. You're not going to have a fat graft as your reconstructive option, but say you have a tissue expander or an implant reconstruction and there's an area that's not exactly quite right, or your skin looks a little thin, we could use fat grafting to improve the shape and just contour it a little better. It's like a natural filler.
Got it. Okay, and there are several different options when it comes to breast reconstruction that you do.
Yeah, so we can use implants if you want kind of a straightforward, easier way to get through. So it's a little bit less involved surgically, or we could use your own tissue to reconstruct a breast in some patients, meaning the belly fat and skin from below. It's kind of like getting a tummy tuck and a breast reconstruction at the same time. Or skin from the back. There's a lot of ways that we could move tissue around and use your own so that you don't necessarily have to have an implant. A lot of different things, and it's a patient-to-patient thing. There's a lot of variables that go into deciding what reconstructive method you use.
And we also saw in the story that Rose had a tissue expansion the first time around.
Right. So when you have an implant reconstruction, we usually put a balloon underneath to blow up the area.
And make room, I guess?
Yeah, make room, exactly. And it gives us control so that week to week we fill it up with saline, and you could really pick the size you want to be. It's a neat way to do it.
And Dr. Collins, you say it's really important for any woman that might be going through breast cancer to get a hold of a plastic surgeon.
Absolutely. And that's the biggest message I want to get out to people is that when you first get this diagnosis, it's overwhelming. And the first thing, and rightfully so, the first thing that you're going to want to do is cure the cancer. And that's going to be your focus. I want people to step back and remember that there is life beyond this cure, and hopefully we're going to get a cure for everybody one day, and you're going to live beyond this. Breast cancer is not like having colon cancer where you could take the piece of colon out and close the belly and you never see it again. It's right there for women every day as a reminder. And so you want to get the best reconstruction and cosmetic result after you have your treatment, because that's going to matter to you going down. It may not matter to you right when you have the diagnosis,
because
you want to get rid of
right,
it.
to the future.
Right. And I was talking to somebody. It's a law in New York that people who are diagnosed with breast cancer need to be referred to a plastic surgeon just to get the information.
Just get the option out there. You don't have to do it right away, right?
They can choose not to do anything at all, but at least get the information, because if you don't know, you're not going to be able to make an informed decision.
And is that something typically insurance covers?
100% of the time. Everything that has to do with your breast reconstruction is covered by insurance, including doing something to the other breast to make it more symmetrical. So, yeah. So there's nothing to fear. It's just having the conversation with somebody who could give you the information.
Because there's so many options as we went through it. You
Yeah,
don't necessarily
absolutely.
have to have the full implants if you
Yeah,
didn't want that.
you don't have to do anything. I mean, you could still do a lumpectomy and go down that road, but you should know what else is out there.
And I'm assuming the treatment would probably kind of reflect on the kind of reconstruction you would have.
Absolutely.
Right.
So some ladies choose to get a bilateral mastectomy when they've had breast cancer in one side, and I think it's a good option. Cosmetically, it's a good option because it's easier for your reconstructive surgeon to get symmetry so that your breasts look the same and they age the same. And that's something that you know, it's not going to do anything to enhance the cure of the breast cancer, but it might do something to enhance your cosmetic result.
There's something to be said about self-confidence at the end of all this, right?
Yeah, it's something to think about.
Very good. Doctor, thank you so much for being here. And for more information, you could visit Beth Collins, MD. Let's try that again. BethCollinsMD.com or call 203-689-5295. All that info is right there on your screen. Again, a lot of information for us. Thanks, Sue.
Right.